Okay, so we've got a couple of pretty interesting health stories that have been kind of popping up in the headlines. One is a potential measles thing happening over in Pennsylvania, and the other
Right.
one is this kind of unsettling rise of this drug-resistant fungus.
Candida auris.
Yeah, Candida auris, that's right, all across the U.S. We've got a whole bunch of reports on both of these. We're going to kind of dive deep and give you guys all the details and also connect the dots on why this stuff actually matters to you.
Absolutely. It is quite fascinating and a little bit concerning at the same time to look at these two situations that on the surface seem very different, but they really do highlight the constant challenge of safeguarding public health. On one hand, we're looking at a very localized potential outbreak of a disease that we have a very effective tool to combat. And on the other hand, we've got this much more widespread kind of insidious threat that is really difficult to tackle.
Yeah, for sure. So let's start off with the measles thing over in Bucks County, Pennsylvania. Looks like the local health department issued an alert yesterday about a possible measles exposure at a Starbucks in Newtown. What are the key things that we need to know about this?
Yeah, so the alert basically says heads up to anyone who is at the Starbucks located at 2896 S Eagle Road in Newtown,
Okay.
last Tuesday, March 19th. And the time window is between 10:50 a.m. and 12:30 p.m. An adult who was vaccinated and had recently traveled to Texas tested positive for measles on Wednesday night.
A vaccinated person. Huh, that's interesting.
Yeah.
And they said it was a relatively mild case. What's the deal with that?
Yeah, so that's a really important point. So while 2 doses of the measles vaccine offer really incredible protection, like we're talking around 97% effectiveness,
Wow.
it's not 100%.
Right.
So you can still get measles even if you're vaccinated. But the important thing is that if you are vaccinated and you happen to get measles, your illness is usually a lot milder. And even more importantly, you are much less likely to spread the virus to other people.
Okay.
So you can think of it this way. The vaccine is not just protecting you, the individual, it's actually helping protect the community by reducing the chances of wider outbreaks.
Gotcha.
And it contributes to what we call herd immunity,
Oh, yeah.
which basically means that if enough people in a population are vaccinated, it makes it much harder for the virus to spread, and it helps protect those who can't be vaccinated.
Right. Those who can't get vaccinated for various reasons. Okay, that makes a lot of sense. So even a mild case in a vaccinated person is still a heads up for the rest of the community. So what kind of symptoms should people be looking out for if they were at that Starbucks?
Yeah, so the initial symptoms of measles, they often look a lot like a common cold. So we're talking cough, runny nose, red, watery eyes.
Okay.
And then after that, you might get a headache, you might have some sneezing. And then the really telltale sign is the red rash. And that rash, it usually starts on the face and neck, and then it kind of spreads down to the rest of the body. So the health department is saying if you were at that Starbucks during that time window, pay attention to those initial signs, the cough, runny nose, red eyes, that sort of thing.
Yeah, keep an eye out for those. And how long does it usually take for those symptoms to appear?
Yeah, that's a really important thing to remember. It usually takes about 10 to 14 days
Oh, wow.
after you've been exposed to measles for the symptoms to show up. So that means anyone who was at that Starbucks on March 19th, they should be looking out for any of those signs, developing over the next couple of weeks.
Yeah, okay.
The health department is also doing their part. They're tracing other places that this person visited,
Okay.
trying to notify anyone else who might have been exposed.
Good, good. So there was actually another measles story that popped up that kind of caught my eye. It involves someone who was traveling on an Amtrak train. So it sounds like the impact of this could be a little wider.
Yeah, that's right. And this is a great example of how interconnected our world is, how transportation networks can really allow contagious illnesses to travel far and wide.
Yeah, for sure.
So on the same day that Starbucks exposure, March 19th, there was a fully vaccinated person who had measles. They traveled on Amtrak's Northeast Regional Train 175. They went between New York City and Washington, D.C.
Oh,
And the train made several stops in New Jersey. So we're talking Newark, Penn Station, Metro Park, in Iselin and Trenton before getting to Philadelphia.
so a lot more people potentially exposed on that train.
Absolutely. So Amtrak is working on contacting those passengers,
Okay, good.
letting them know about the potential exposure. This individual was actually a resident of Minnesota, and they ended up going to an urgent care clinic in D.C. a few days later on March 22nd.
Okay.
And it's interesting, the health officials clarified that this person was not contagious during their flight from Minnesota
Oh, okay.
or while they were in Minnesota. So the warnings are very specifically focused on the time that they spent traveling on the Amtrak train and then going to the urgent care facility.
And there were some specific times and locations mentioned for the potential exposure in D.C.
Yes, that's right. So the DC Department of Health has issued alerts for the Amtrak concourse at Union Station in DC, and the time frame there is between 11 p.m. on March 19th and 1:30 a.m. on March 20th,
Okay.
and also for MedStar Urgent Care on Columbia Road on the evening of March 22nd from 7 p.m. to 11 p.m.
It's pretty concerning, when you see the numbers from the CDC. 378 confirmed measles cases in the U.S.
Yeah,
as of March 20th, and a good number of those people had to go to the hospital, and there have even been 2 deaths.
right.
So it's kind of a reminder that even though we have a vaccine, measles is still something that we need to take pretty seriously.
Absolutely. The vaccine is great, but these figures really underline, how serious the disease can be, especially for people who aren't vaccinated or who have weaker immune systems for whatever reason. And I think it's important to point out what the DC Department of Health said about people born before 1957 and those who are vaccinated. They're generally not considered at high risk in this particular situation.
Yeah.
And that's because people born before widespread measles vaccination, they probably actually had measles when they were kids. And so they developed natural lifelong immunity.
Oh, right. Yeah,
Yeah.
that makes sense. Okay, so that gives us a pretty good overview, I think, of what's going on with these measles situations. Now, let's switch gears and talk about something that honestly sounds a lot scarier to me. This drug-resistant fungus, Candida auris, it's also called meadowings, and the CDC has labeled it as an urgent antimicrobial resistance threat.
Yeah.
That phrase alone, kind of sends chills down my spine.
Yeah, it means they're really worried. The CDC is very concerned about how quickly C. auris is spreading. And what makes it such a big deal is that it's often resistant to multiple antifungal medications. And that basically means the drugs that we usually use to treat fungal infections, they might not work.
Oh, wow.
And if that wasn't bad enough, it's also incredibly resilient. It can actually survive on some of the common disinfectants that are used in hospitals.
Right.
So it's a real challenge to get rid of it, especially in healthcare environments where you have a lot of patients who are more vulnerable to infection. And Candida auris is a fungus. We often hear about bacteria and antibiotic resistance, but this is a fungus.
Right. So not only is it really difficult to treat the people who get infected, it's also incredibly difficult to eliminate it from the places where those people are most susceptible in the first place.
Exactly. It was first identified in Japan back in 2009, and since then it has spread all over the world. It's caused outbreaks in hospitals and long-term care facilities. Earlier this year, Public Health Ontario in Canada, they took a pretty big step. They classified it as a disease of public health significance.
Wow.
And what that means is it triggers mandatory monitoring,
Okay.
and they have to put in place these really stringent control measures.
To try to contain it. Wow, that's pretty serious.
Yeah.
We got some interesting insights from microbiologist Jason Tetro. He explained that it's a type of yeast that can actually live harmlessly on some people's skin,
That's right.
but it can become really dangerous if it somehow gets inside the body. That's kind of freaky, to be honest.
Yeah, it is. It's one of those things that can be a little creepy when you think about it too much. So Pseudomonas can colonize the skin, and that basically means that it's living there, but it's not actually causing any harm to the person who's carrying it. But if it manages to get into the mucous membranes, like in the respiratory tract or the urinary tract, or even worse, if it gets into the bloodstream, then it can cause these really severe infections.
Oh, gosh.
And those infections can be life-threatening. And of course, this is especially dangerous for people whose immune systems are already weakened. Maybe because they have other health conditions or they're undergoing certain treatments.
Right, and the death rate, the mortality rate for people who actually get a C. auris infection is pretty scary, isn't it?
Yeah, it is. Reports suggest that the mortality rate for those who develop a C. auris infection can be as high as 50 to 60%.
Wow.
It's a really serious threat to certain populations. And the other thing is that people can be colonized with C. auris for a really long time.
Oh, wow.
We're talking potentially years
And not even know it.
without showing any symptoms. And during that whole time, they could be spreading it without realizing it.
So if people don't even know they have it, how is it spreading so effectively?
Yeah, that's a great question. So the main ways it spreads are through direct person-to-person contact or through contact with surfaces that are contaminated.
Oh.
And C. auris can actually live on surfaces like bed rails, doorknobs, medical equipment for weeks. And here's the really troubling part. Many of the standard cleaning products that they use in hospitals, they don't work against it. So you need these much stronger disinfectants, things that contain hydrogen peroxide or bleach to really get rid of it.
So it's very difficult to get rid of.
Yeah, it's really hardy.
So there was a study out of Florida that showed a really rapid increase in CRS cases. What were the key findings of that study?
Yeah, so that study was recently published in the American Journal of Infection Control,
Okay.
and they looked at trends in clinical cultures, the tests they do to identify it, in hospitals all over Florida. And they looked at the years between 2019 and 2023. And what they found was a really significant upward trend
Oh, no.
in the number of cases that were being identified every year. And what was even more concerning was that every single one of the CRS samples that they looked at, they were all resistant to fluconazole. And fluconazole is a very common antifungal medication.
So that's not good.
No, it's not.
It's not only increasing in numbers, but it's also becoming more difficult to treat.
Right, exactly.
So how does the situation in Canada compare to what we're seeing here in the U.S.?
Yeah, so Canada has reported a much smaller number of cases. They've had a total of 65 since 2012.
Okay.
And 46 of those have occurred since 2019. So the numbers are lower, but the fact that the Canadian public health officials have designated it as this disease of public health significance shows you how concerned they are. And they're really taking it seriously. They're doing everything they can to try to contain it.
Yeah.
In the U.S., the increase has been way more dramatic.
Oh, wow.
It went from only 51 cases in 2016 to a whopping 4,515 new cases in 2023.
That's a huge jump.
Yeah, it is. It's exponential. And that's why health officials are so worried.
It's reassuring to hear that it's not resistant to every single antifungal drug, but the fact that so many commonly used ones are ineffective is still pretty scary.
Absolutely. It's not pan-drug resistant yet. But the fact that so many readily available antifungals aren't very effective, it really limits the treatment options. There are some medications that do work against it, but as experts have pointed out, they're usually reserved for really severe cases, the really resistant infections.
Right.
They're not part of the standard treatment protocol that you would use for a typical fungal infection.
Right. And it sounds like the symptoms, when they do appear, are pretty general. Like they could be mistaken for a lot of other things.
Yeah.
Which could make it difficult to diagnose quickly.
Yeah, that's exactly the challenge. Some of the symptoms can include things like a urinary tract infection. You might have a fever and chills that just won't go away, or a bloodstream infection. But remember, as we talked about, a lot of people who are colonized with CREs, they don't have any symptoms at all.
Right.
So that makes it even harder to track and contain the spread. So that's why the experts are really putting so much emphasis on surveillance, early and accurate detection. And really strict infection control procedures.
Especially in healthcare settings.
Especially in healthcare settings, yeah.
Fox News actually reported a really sharp increase, 580% increase.
Wow.
In positive clinical cultures for CRs from 2019 to 2020 in the U.S.
Just in 1 year.
Just in 1 year. So it really shows you how quickly this is spreading in our healthcare systems. And Georgia specifically had over 1,300 cases by the end of February this year. So it seems to be hitting some areas harder than others.
Yeah, and those figures are very alarming.
Yeah.
They really highlight how much strain this fungus is putting on healthcare resources in certain parts of the country. Dr. Mark Siegel, who was featured in that Fox News report, he called it a serious emerging problem. And he's right. It is a big deal because it's resistant to so many drugs. And it spreads so easily in hospitals. And of course, it tends to affect the people who are already the sickest.
Yeah, those who are already immunocompromised.
Yeah, right. Exactly. And the fact that the symptoms can be so easily mistaken for something else, another more common infection, just makes it that much harder to diagnose it quickly and get people the right treatment.
Okay, so to kind of wrap things up here, we've really looked at two very different public health situations, but they're both equally important. We have this localized risk of measles exposure that's connected to travel and a public place. And then we have this much broader and much scarier, in my opinion, rise of this drug-resistant fungus within our healthcare system.
Yes, that's a great summary. And I think the key takeaway for our listeners is this. For the measles situation, if you were in any of those locations that we talked about, during those specific times, pay attention to the potential symptoms.
Yeah.
And remember that vaccination offers really strong protection.
Yes.
And it's not just for you, it's for everyone around you.
It helps the entire community.
Right. And then with Candida auris, it's all about understanding how rapidly it's spreading, how resistant it is to many of the treatments that we have. and how crucial it is to have really good infection control practices,
Especially in healthcare settings.
especially in healthcare settings,
Yeah.
yes, to protect those who are most vulnerable.
Yeah, and when we think about how these two seemingly unrelated stories
Mm,
connect back to, our listeners and their interest in getting informed quickly and thoroughly, it really shows you how interconnected our world is when it comes to health. Travel can introduce or reintroduce, these infectious diseases into new areas, and we're seeing that with the measles cases. And then you have this whole issue of antimicrobial resistance, which is a global problem. And C. virus is a perfect example of that. It has huge implications for how we manage infections in the future. For me, the aha moment is recognizing that even something that seems like a contained local outbreak
right.
can actually have these wider ripple effects, and that the scientific and public health communities are always working, behind the scenes to monitor these threats and respond to them as they evolve.
That's a really insightful way to tie those two things together. It really highlights the constantly changing nature of public health
Yeah.
and how we need to be vigilant and adaptable, as we face these new and emerging threats.
So I guess as we wrap up this deep dive, it leaves me with this question. In our increasingly interconnected world, what steps can we take, both as individuals and as a society,
Yeah.
to prevent and manage the spread of both vaccine-preventable illnesses like measles and these drug-resistant pathogens like C. aureus? It's a big question, and there's no easy answer,
Yeah.
but it's definitely something that we all need to be thinking about.
It is a big question, but it's an important one. And it's one that deserves ongoing consideration and discussion as we move forward.
For sure. Thanks for joining me today for this deep dive. Until next time, stay safe out there
You too.
and stay informed.
Absolutely.